Hey everyone, it's Dr. Bowen. I'm a board-certified physiatrist here at New Jersey Regenerative Institute, or NJRI. I work together with Dr. Thomas Agason to provide non-surgical solutions to orthopedic problems. Our goal here is to help you release your intrinsic ability to heal. Today, I want to take some time and go over the 8 most common knee problems we treat at NJRI. Whether you're an athlete or just someone dealing with chronic pain, or just curious about the knee and the health of it, this video is for you. We'll be posting new content on the knee every week, so be sure to subscribe and hit that like button and bell notification so you don't miss anything. We'll cover a range of knee problems from conditions and injuries like arthritis and discuss symptoms, causes, and treatment options. So let's get started. First up, let's talk about knee anatomy and function. The knee is a complex joint composed of bones, ligaments, cartilage, and tendons that all work together to provide stability and mobility. It's a marvel of biomechanical engineering, crucial for both stability and mobility in the human body. It's composed of a junction between the femur or the thigh bone and the tibia or lower leg shin bone. And in front of that is a kneecap or patella. The knee is a complex hinge joint that facilitates movement between the upper and lower leg. Its structure includes cartilage, ligaments, tendons, and synovial fluid, all working in harmony to absorb shock, bear weight, and allow a wide range of movement, from walking and running to bending and kneeling. We also need to consider that the knee sits between the hip and the foot, and these both can affect it. Beyond its mechanical prowess, the knee plays a central role in everyday activities and sports, making it prone to various injuries and conditions. Understanding its anatomy and the function is essential not only for athletes and for those recovering from problems, but anyone interested in maintaining health and a healthy joint throughout their life. Now, one of the most common knee issues we see in our clinic are ligament injuries, particularly the ACL or anterior cruciate ligament and the MCL or the medial collateral ligament. These injuries often occur during sports or activities that involve sudden changes in one direction or impact. The ACL lives inside the joint, and treating an ACL tear typically involves both non-surgical and surgical options, depending on the severity of the tear, the individual's activity level, and their overall health. Here at NJRI, we advocate for the non-surgical approach whenever it's possible. If you think you have an ACL or an MCL tear, you likely heard a popping sound at the time of the injury and felt immediate, intense pain. This is usually followed by noticeable swelling soon after. If you are currently struggling with instability, swelling, or difficulty walking after an ACL or an MCL injury, call our office for a consultation. Be happy to help you. Moving on to knee arthritis. It's a condition where the joint's cartilage deteriorates over time, causing pain, stiffness, and swelling. It's prevalent among older individuals, but can also affect younger individuals due to injury, prior surgery, or genetic factors. Stay tuned for a video next week that will dive deep into this issue. In that video, you'll find a longer explanation of the condition as well as our proposed treatment options. Next, let's discuss meniscal tears, another common knee problem. These are often caused by twisting or overflexing the knee, leading to pain, swelling, and sometimes locking, catching, or feels like a stuck piece of that joint. Non-surgical treatment options for meniscal tears typically depend on the size, location, and the severity of the tear, as well as the individual's symptoms and activity level. Initially, treatment often includes the classic RICE protocol, which stands for rest, ice, compression, and elevation. Although most people have heard of RICE, they really haven't heard of MEAT, which is preferred. MEAT is an acronym for movement, exercise, analgesics, and treatment. Physical therapy plays a crucial role in non-surgical management by focusing on strengthening of the muscles around the knee, improving flexibility, and restoring normal movement patterns that also include addressing the hip and foot. Therapists also may incorporate modalities to aid in pain relief and promote healing. Additionally, temporarily modifying activities to avoid movements that exacerbate symptoms, such as squatting or twisting, can help facilitate healing of that meniscal tear without the need for surgery and reduce your pain. Patella tendonitis, or tendinosis, is also on our list. This is a condition that involves inflammation of the tendon that connects the kneecap to the shin bone. It's frequently seen in athletes who engage in jumping sports, which is why it's often referred to as jumper's knee. This condition is characterized by pain and tenderness around the lower part of the kneecap, or patella, where the patella tendon attaches to the shin bone, or the tibia. The pain is often localized and may feel like a dull or sharp stabbing sensation, especially during activities that involve jumping, running, or kneeling. Usually the pain is worse with exercise and improves with rest. Swelling and stiffness around the knee may also be present, particularly after periods of activity or prolonged sitting with the knee bent. In some cases, there may be a feeling of weakness in the knee or difficulty fully straightening the leg due to tightness and discomfort in the tendon. Bursitis, characterized by inflammation of the bursa or fluid-filled sacs that live around the knee joint, can cause pain and swelling. Despite many people and physicians stating that they actually have bursitis, it's extremely uncommon in our patients who do not have an underlying rheumatologic condition. The bursitis problem is usually from a tendon pathology or problem. It's often linked to repetitive motions or kneeling for extended periods of time. This condition tends to occur more frequently as people age and is likely due to altered biomechanics, such as poor flexibility and weakness that causes overload. Additionally, rheumatoid arthritis, gout, or diabetes can increase susceptibility to bursitis due to their impact on joint health and inflammation. Typically, we treat this by first evaluating your movements, including the hip, knee, ankle, and the whole kinetic chain, to address those deficits with exercise and stretching, and/or formal physical therapy if felt to be needed. If this fails, further investigation would be considered. Osteochondral defects refer to specific types of injuries or damage that affect both the cartilage and the underlying bone within a knee joint. This condition typically occurs in weight-bearing joints, such as the knee, ankle, or elbow. Symptoms include severe pain, inability to weight bear, and visible deformity. The diagnosis typically involves a thorough physical examination by a healthcare provider, like myself, along with imaging studies such as an X-ray, MRI, or CT scan. These tests can help visualize the extent of cartilage and bone damage and can determine the appropriate treatment approach. Osgood-Schlatter is another problem, and this is a common cause of knee pain in growing adolescents, especially those involved in sports. It occurs from inflammation in the growth plate just below the kneecap. Sometimes there's a bump at that painful site and it becomes noticeable. Typically, the best approach to the treatment for these young athletes is to be conservative with relative rest, meaning reducing your activity level until your symptoms and your pain is gone, with occasional use of ice and Tylenol. If this doesn't resolve your problem, you should seek medical evaluation as it may be something different or to obtain other treatment options. The IT band or ITB syndrome is another common overuse injury that affects the iliotibial band, which is a thick band of connective tissue that runs along the outside of the thigh from the hip to the shin bone or the tibia and across on the outside of the knee. It occurs when the ITB becomes tight or inflamed and leads to pain and discomfort, typically on the outside of the knee or outside of the thigh and hip. Factors such as poor mechanics, sudden increases in activity level, inadequate stretching or warm-up, or muscle imbalances can contribute to the development of ITB syndrome. There you have it, the 8 most common knee issues explained. Remember, early diagnosis and appropriate treatment are crucial for managing knee pain and problems effectively. If you're experiencing persistent knee pain or have concerns or questions, don't hesitate to consult a healthcare provider. I'm in New Jersey and I'd be privileged to see you in person or virtually if you have continued knee issues. Just call the office to schedule an appointment. If you found this video helpful, please like, subscribe, and hit that bell notification for more health tips and information. Costs you nothing, helps us a lot, and I really appreciate it. You can also find us online at NJRI.com, TikTok, Facebook, Instagram, and X, all of which are linked in our link tree and our homepage and pinned below. Feel free to leave us a comment, letting us know what you'd like to hear more about. Thanks for watching.